Hello everyone, this is the third video I'm recording, and this is about colon cancer, metastatic colon cancer. And as you know, I'm an oncologist. I used to be an oncologist. My diagnosis was around 9 months ago, and right now I'm talking to you from ICU of Vanderbilt. Uh, let's a little bit talk about other things than the disease, about how the disease affects you uh, emotionally, how it affects your family. Uh, Initial phase is like depression, anxiety, disbelief, anger, and all those things. And then you come to the moment that you accept this. Sorry, I'm talking very slowly because I have to catch my breath due to my lung disease. Yeah, so you uh, come from the place that you work, and a stable disease, a stable life, hopefully, and to these nasty things, and which comes with a lot of things. Um, for me, I was able to find a job after so many years. I was very close to be stable. Actually, in 1 week, I was going to buy a very nice house, and I paid the deposit. I lost it anyway. Doesn't matter. Uh, it interferes with your dignity. You come from very powerful state to the point that your wife has to push your stretcher, and you think about capsules of oxygen. But different people take it differently. If you're a spiritual person, I'm sure you find a way. If you're really a religious person, also you find your peace. But if you're, I don't know, lonely, not social, depressed person, doesn't want to be, doesn't want to say like me, but it is harder for you to cope. Uh, my wife almost lost her job because she had to come many days to take care of me. My parents had to come and stay with us because I can't be alone in any day. So it affects your life and your family and your thoughts and everything that you learn about this life, about the meaning of the life. One example of this is when we are oncologists, we look at overall survival, progression-free survival, before we look at anything else. But when you're on the other side of the fence, first thing you look as a patient is a response rate. Here, I just want to tell you the difference of the meaning of hope. Even the slightest thing with even uh, side effects, any trial, you just want to join because you want to live longer at any price, as long as you're functional. Uh, so let's go back and talk about my disease a little bit and what happened. First, I was on uh, fulfirinox, as you know, for about 9 cycles. Then we took out oxaliplatin because of peripheral neuropathy for 2 cycles, or 1, and then he switched to maintenance 5-FU-BEV. And that was the time that CT scan showed maybe lymphangitis carcinomatosis. So what is lymphangitis carcinomatosis? It is a spread of the tumor through lymphangitis system. It's not a good thing. It's not common, and it's very hard to treat. To the point that when I asked ChatGPT, it says you should be grateful that you're alive another day. I don't know if that is sarcasm or the reality, but in the literature mostly says weeks to months, and I know people that live with it about 2 years, and I know people who live with it uh, just few months. So it's 2% of colon cancer patients are unlucky to get this complication, and it is also common in lung and breast cancer, but it is easier to treat in those scenarios. But in gastric cancer and colon cancer, once you get it, it's hard to treat. You may treat it and it goes away and it comes back, unfortunately, again. So I was admitted to hospital 4 months ago, and I got kitchen with the sink again, sulfoxyri plus bevacizumab, and 1 cycle, and my oxygen requirement came down from 6 liters to 3 liters with the help of steroids and chemotherapy. So I was discharged, and I continue chemotherapy as an outpatient. But gradually my oxygen requirement went up and up from 3 to 4, 5, 6, 7, especially after each chemotherapy. So I asked my second opinion doctor, what else can be done? What else can be added? You know, my TMB was 10, and in colon cancer, if you have TMB of 10 alone, response rate is around 2 to 4% only, and it's not MSI high. I had MSS disease, but when it combined with chemotherapy, there's a possibility that number is higher. So we did that. I received 2 cycles, and I'm in hospital ICU because now I require 10 liter of oxygen at rest and 15 liter with exertion, which is going up and up every day that I spend in ICU. And I played a role of a doctor myself. I've been my advocate from calling different radiologists, talking to different pulmonologists and oncologists, comparing test results, and so on. Maybe sometimes it's not a good idea, but in oncology field, I guess you should be really involved. Feel free to have second opinion all the time. At least establish care so you can talk to them over phone later. The only problem is each time we have the CT scan, we have to push it to different system. That's a little pain in the butt. So a lot of radiologists, they think that there is no clear progression of disease, and pulmonologists believe that I have progression of disease because I require more oxygen. Myself think there is some part of pneumonitis involved, because I had this problem before starting immunotherapy, and that was with chemotherapy only. Each time I come home, day 5, 6, 7, I require more oxygen and more steroids. So, and I have loculated pleural effusion which we drain, but it didn't help. So you see how a lot of problems is a combination of pleural effusion, pneumonitis, progression of the disease, and so on. Uh, anyway, my disease in liver and peritoneal disease are stable each time we do the CT scan, which is a good thing, but this lymphangitis spread is so aggressive that probably it take me in a matter of few days. The other thing I wanted to talk about is clinical trials and the fact that they are very strict inclusion and exclusion criteria for somebody like me with involvement of the lung. Obviously, I'm on oxygen and on steroids. Because of these two, they don't let me have a chance to participate in their trials. That is a very sad thing. And not only one company. This is across the board. And obviously they want to have their phase 1, their phase 2 to have good results, not to bring a dying man with many complications who is obvious to die in a few days. And beside that, there is compassionate use of these drugs that can be very good as per anecdotal data or phase 1 data, but they can be available after phase 3 and FDA approval, which is another 3 or 4 years, less or more, and it's too late for a lot of people like me that impatiently are waiting to receive them. I think FDA should come up with some sort of solution, especially for this disease that's killing so many people. Yeah, it would be nice if I could have the compassionate use. I don't want to name the companies. Yeah, that is where my journey was, and most likely this is the last video I record. I wish I could record more videos, but here I'm being pushed about hospice, and maybe that's the reality. If my oxygen requirement goes up and up and up like this, and we tried everything, we said, okay, it's pneumonitis, let's do IVIG. We did 5 days of IVIG, it didn't work. We did high dose steroid, 500 milligram methylprednisone. So we are waiting for the result, most likely no change. And we will try also infliximab for steroid refractory pneumonitis. But most likely, if it's not pneumonitis, it's the progression of the disease, and I have to accept this fact. Alright, I wish you the best, and hope you do your colonoscopy sooner in your life, hopefully at age of 40. I love you all, and goodbye.